So we're quickly looking at the next condition which we'll be discussing. Now, this is what is known as a premenstrual syndrome. Premenstrual syndrome. So for the premenstrual syndrome, we go from the common causes, common symptoms, we go to the causes, we go to the diagnosis, then we go to the possible treatment options that you might actually want to employ for premenstrual syndrome. So first of all, you should know that this is just a collection of how a person is feeling. That's the physical stuff, the emotional stuff, all right, behavioral changes, all right, that occurs in 1 or 2 weeks before menstruation. So as a woman is approaching their menstruation, you notice that their behavior is changing and all of that. There's drama, pulling up some funny behaviors like that. So that's just what the premenstrual syndrome means. So it can vary widely from person to person. Some women are menstruating and you will not know. You understand? So women are menstruating and everybody must know. You understand? So for the emotional and behavioral side, she can be having mood swings. She can be easily pissed off at things. That's irritability, or she easily gets angered. So anxiety, feeling overwhelmed, sadness or crying spells, trouble concentrating in class, or she's sleeping too much, changes in libido. That's like how she's attracted to the opposite sex. So some women during their menstruation, they're attracted to the opposite sex more, and even when you come to them, they now give you drama. You understand? It's not their fault. Then maybe there's changes in appetite, she's not really eating well and all of that. So for the physical changes, you can be having things like abdominal bloating, the stomach can be getting swollen up, then she can have some weight gain. The breast will be more soft, that's tenderness, headache or joint pain, muscle pain, she's weak, that's fatigue. Then pimples will now be more on her face, that's acne flare-ups. All right, digestive changes, like she can be passing out watery stools, or sometimes she's having problems with passing stool like she used to do. That's constipation or diarrhea. So what actually causes this premenstrual syndrome? It's not fully understood because it's actually nature. All right, so anything that is nature, human understanding on that is usually limited. So it's mostly nature. So now it's usually linked to hormonal fluctuations, right? Brain chemical changes, particularly serotonin. Then underlying mental health conditions like depression, anxiety, all of this issue worsen the symptoms. So diagnosis, you just know that there's no single diagnosis, but if you see a woman experiencing such a thing, you might just do her good by asking her if she's approaching her menstrual cycle. You understand? So tracking symptoms over at least 2 menstrual cycles will now make you know that, okay, this woman, she usually has this issue when she's going towards her menstruation time. They also rule out other conditions like thyroid disorders or depression or perimenopause. I want to rule out that, okay, the woman is not approaching her menopause. So treatment is lifestyle changes, regular exercise, she should sleep more. Sometimes it's stress combined with you approaching your menstruation now blows it up. Reduce caffeine intake, reduce the way you take alcohol, reduce the way you take salty food, manage your stress like yoga, meditation. So you can also take some drugs like non-steroidal anti-inflammatory pain and non-steroidal anti-inflammatory drugs if the pain is getting so much. Then hormonal birth control to stabilize the hormone levels. All right, then drugs to just lighten up your mood, diuretics for bloating, supplementary drugs like calcium, magnesium, vitamin B6, chasteberry. All of these have roles in bringing you back to the livelihood.